Welcome back, everyone. The Center for Disease Control has found heart disease to be the leading cause of death in the United States. For those suffering from heart disease in Yuma, the effects of the disease hit close to home. Our own Cord Zepernick has more in this exclusive report you'll only find here on 13 on Your Side.
February is American Heart Month, and heart disease remains a problem here in Yuma and in Arizona at hospitals and hospice care.
Every year there are almost 800,000 heart attacks in the United States. One person has a heart attack every 34 seconds.
Yuma County averages 130 deaths per 100,000 people due to complications from cardiovascular disease, according to the 2022 Yuma Regional Medical Center Health Needs Assessment.
And I think the major determinant of that is age. And cardiovascular disease is disease of age, and we are all living longer. And so there is a higher chance of getting cardiovascular disease.
Despite mortality rates being lower in Yuma and across Arizona compared to neighboring states such as California, the dangers associated with the disease impacts each life touched.
Folks do have tons of cardiovascular disease. They have stents in their hearts or need stents in their heart. They've had bypass surgeries.
Heart disease is an umbrella term with many complexities in its causes and effects, including diabetes and heart attack. For those nearing the end, Yuma Hospice Care has and continues to play a critical role for those who are in the advanced stages of heart disease.
So when we're talking about cardiovascular disease, we average anywhere from 60 to 65 patients per year.
Yuma Hospice Care is able to identify the additional results of heart disease for its patients.
Heart disease is common, so you can have had a stroke, you can have cancer, you can have any one of a number of other terminal conditions and have heart disease as a so-called comorbidity.
Local patients with heart disease know the challenges it brings. For Barbie Parks, she remembers her first signs and symptoms as if it was yesterday.
And all at once, I lost every bit of energy I had in my body. I knew something was going on strange. So I said, call 911. The girls did. And I got to the hospital.
Now in recovery for several years, Barbie lives a happy and functional life and offers advice for those who may have been suffering just like she did at one point.
Live your life to the fullest. Follow your doctor's orders and take care of yourself.
Dr. Chandra is optimistic about how Yuma's population can avoid a diagnosis.
And the good news is that a lot can be done about it preventatively by how we live our lives. And that is basically by knowing your risk factor profile, knowing how careful you've got to be in your lifestyle choices.
There's a variety of causes of heart disease, but three in particular are the most common.
Cholesterol is a waxy, fatty substance that deposits within the wall of the blood vessels. Number one risk factor is high blood pressure. The second is high cholesterol, diabetes, and last but not the least, smoking.
Yuma citizens can follow several important lifestyle steps to decrease their risk, beginning with what's on your plate.
Change your diet. Try to go with a Mediterranean diet.
Then comes getting up and at 'em.
And the second is exercise. So the recommendation, according to the 2019 American College of Cardiology, American Heart Association guidelines, is 150 minutes of moderate exercise in a week, or 75 minutes of vigorous exercise in a week.
Safe to say, diagnosing, treating, and living begins with each beat of the heart. For more information on resources to learn and care for heart disease, visit our website at kyma.com. Reporting in Yuma, I'm Cord Zepernick.